from BSN3A, I am Jansel Marie S. Sanguesa, and for today's tutorial demonstration, I will be performing nasogastric tube feeding. So without further ado, let's get started. For the assessment, we have to determine if it is really a doctor's order for us to be able to perform a right procedure to the right client. Then we also have to assess the client's level of consciousness and level of knowledge and understanding. And then we also have to assess the availability and functionality of the needed materials. This is to determine that everything is ready and working. And then we also have to assess for any clinical signs of malnutrition and dehydration. Lastly, assess for allergies to any food in the feeding. If the client is lactose intolerant or cannot digest sugar in the milk, which will result to diarrhea, gas, and bloating, you have to check the tube feeding formula. Notify the primary care provider if any incompatibilities exist. For the planning before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feedings.
Prepare equipment including correct type and amount of feeding solution, 60 ml catheter tip syringe, MSS basin, clean gloves, large syringe or aseptic syringe, measuring container from which to pour the feeding, 60 ml water.
For the implementation, prior to performing the feeding, introduce self and verify the client's identity using agency protocol. Then we also have to explain our client what are we going to do, why is it necessary, and how he or she can participate. Then we also have to inform our client that the feeding should not cause any discomfort, but may cause feeling of fullness.
Good day, sir. I am Jansel Marie S. Sanguesa, a student nurse from NUST, and I will be your student nurse for today from 7 a.m. to 3 p.m. And for today, I will be feeding you through your nasogastric tube. So, ito pong pagpapakain po sa inyo ay hindi po dapat kayo makaramdam ng kahit anong discomfort. Bagkus, kayo po dapat ay makaramdam ng pagkabusog. Naiintindihan po? Handa na po kayo? And then, you have to perform hand hygiene and observe appropriate infection control procedures such as wearing clean gloves. Next, you have to provide for client's privacy for the procedure if the client desires. Tube feedings are embarrassing to some people, so we can achieve it by closing the door, the window, or the curtains. And then, we have to assess the tube placement. You have to attach the syringe to the open end of the tube and aspirate, and then check the pH. Allow 1 hour to elapse before testing the pH if the client has received any medication, and then use a pH meter rather than pH paper if the client is receiving a continuous feeding. Follow agency policy if the pH is equal to or greater than 6. Afterwards, we have to assess the residual feeding contents. If the tube is placed on the stomach, aspirate all contents and measure the amount before administering the feeding. This is to evaluate the absorption of the past feeding. That is, whether undigested formula from previous feedings remain, or if the tube is in the small intestine, residual content cannot be aspirated. And now we can administer the feeding. Before administering the feeding, you have to check the expiration date of the feeding. Warm the feeding to room temperature, because an excessively cold feeding may cause abdominal cramps. And then we have to clamp the feeding tube before all the water is instilled. Clamping prevents air from entering the tube. Ensure the client comfort and safety. Secure the tubing to the client's gown. This is to minimize the pulling of the tube or preventing discomfort and dislodgement. And then we have to ask our client to remain sitting upright in follower's position or in slightly elevated right lateral position for at least 30 minutes. Because these positions facilitate the digestion and movement of feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs.
Sir, nangyari lamang po na manatili po kayo sa ganyang posisyon hanggang makalipas ang 30 minuto. Ito po ay upang makatulong sa pagbaba ng inyong kinain at para maiwasan din po ang mga posibleng komplikasyon. Naiintindihan po? Salamat po.
For the evaluation, we have to evaluate the patient's response to the procedure and document the procedures and other important data on the client's chart. And that's it for the return demonstration of nasogastric tube feeding. Thank you for watching!